If you have back pain, instinctively you want to rush out and get an X-ray or an MRI. But I'm going to explain to you why that is probably not necessary, and why if you've had one already, what the report says may not even matter. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links we mentioned in the video can be found in the description below. As always, this information is meant for educational and demonstration purposes only. With that out of the way, let's get into it. The use of X-rays and MRIs are commonly used as a diagnostic tool for low back pain, and they are also the most unnecessarily overutilized tools as well. Imaging is amazing in its ability to find abnormalities in the areas it scans. However, there's one big problem. While they're great at identifying things, they are terrible at determining if abnormalities are the cause of your pain. Sometimes patients will get frustrated with the hesitation of their doctors to order MRIs for their low back pain and sciatica. However, it likely means that they are well aware of the research and are likely a really good physician. Imaging is usually not recommended for at least 6 weeks from the onset of injury, and there are a couple of reasons for this. First, statistically, most back pain will either resolve by itself or respond to conservative care within about 6 to 8 weeks. Second, all these abnormalities that show up also show up in people without pain. As always, there are exceptions to the rule, and early imaging is recommended in these scenarios: when there's been significant trauma with associated spinal tenderness, when there's severe or progressive weakness, changes in bowel and bladder function, severe and persistent low back pain, or failed conservative care. But let's take a look at how common some of these things are. Remember, these statistics are people that do not have any pain. Annular fissures, which are tears in the disc wall, appear in 19% of 20-year-olds and increase up to 29% of 80-year-olds. Disc protrusions appear in 29% of 20-year-olds and increases up to 43% of 80-year-olds. Degenerative disc disease appears in 37% of 20-year-olds and 96% of 80-year-olds. Remember, no pain. Disc bulges appear in 30% of 20-year-olds and up to 84% of 80-year-olds, again, without any pain. So if these problems show up frequently in people that don't have any symptoms or pain, how do you know if they're the cause of people that do have pain? The short answer is that you don't. Well, at least not from imaging alone. What those numbers do tell us is that these abnormalities are likely just a part of the normal aging process, rather than a disease that requires a medical intervention. Another way to look at this would be if your engine started making a grinding noise while driving. So you take it to your mechanic. The mechanic lifts up the hood, takes out their phone, and snaps a picture. They look at the picture closely before telling you that you need a whole new engine at a cost of $5,000. Would you accept that level of investigation for your car? Probably not, but thousands of people accept that same level of thoroughness for their very own body, and this happens every single day. In order to get a more accurate diagnosis, the mechanic needs to ask you about when the noise started, when it happens, take the car for a test drive, accelerate, brake, etc. That is the only way to narrow down the possibilities to determine the most likely cause of the issue. Much like a car, humans are a dynamic system with lots of moving parts. So testing a dynamic system with a static assessment tool is problematic right from the start. The takeaway is that you should not rely solely on something on an image, especially since radiologists who read them have no knowledge or context of a person's symptoms. This usually results in the over-reading or over-interpretation of the scans. There must be other signs and symptoms that correlate with the imaging results to make them relevant. In fact, more often than not, it's the in-depth discussion with the patient that provides the best information for making an accurate diagnosis. Before you go, if we provided some value, please hit the like button, share us with your friends, and so you don't miss out on any of our videos, click subscribe and the notifications button. Thanks for watching, and we'll catch you on the next one.